Wonderful. Well, let's continue the conversation about health this morning, and we're doing that with Katy Bonner, who is joining us. She is Vice President of Marketing and Member Experience when it comes to United Healthcare. Thank you so much for joining us.
Sure, thank you.
'Tis the season when we have a lot of family members coming back to town for the holidays, and maybe when we're seeing our loved ones, parents, grandparents, we're seeing that their health is changing, and we want to know how to start that conversation of letting them know there's assistance out there where they can still stay at home, correct?
Correct, yes. And in fact, it's great an opportunity to really highlight and spotlight the benefits that are available. So Iowa has 7 waivers for our members in Iowa, and in order to really help them know what's available, we thought it'd be a great opportunity to talk about one of those waivers specifically.
Okay. Now what are you talking about when you say waivers? Because as Jackie mentioned, this is the time of year families are getting back together.
Yep.
Maybe you haven't seen a relative, an elderly relative, for a while, so now you have a comparison about what they were like before and what they are like now, and they might be struggling a little bit, and you have a chance to help them out. Now, what is a waiver that you mentioned?
Sure, a waiver is something that is an additional service or benefit available to Iowans above and beyond that of traditional Medicaid in the state of Iowa.
Okay.
So the Iowa Elderly Waiver is one of the 7 waivers, and there is a really wide range of services or benefits available for an Iowan who is Medicaid eligible, a U.S. resident, and 65. They can qualify for things like adult daycare, the help by fallen and can't get up personal emergency response, in-home meals. They can even qualify for someone to come home and help them with their household chores.
Are you serious?
Yes, home and vehicle modifications. So really the whole goal is to help these Iowans live healthier lives by staying in their homes and their communities, because that's where we know they want to be.
Right.
It's better for everyone.
Right, exactly.
And people probably didn't even realize this existed. So this is United Healthcare's home and community-based services with a waiver network, is what you're saying, all across the state, correct?
Correct. So we have a team of Iowans that actually live in the communities across the state of Iowa, work for United Healthcare, and they are out all across the state providing training and face-to-face education for these people that would provide these waiver services for Iowans who do wish to stay in their homes in the communities.
Okay.
So it's a really big network of people that work in the communities that serve Iowans who are eligible for a waiver such as the elderly waiver.
So we know what's right there around where your relative or a friend might happen to be.
Exactly, yes. They're all over the state and the communities, both rural and in the bigger cities.
Wonderful. Let's take a look at who qualifies, because we have a full screen that we can show you that kind of marks everything down for you, and kind of what you were saying before of a certain age.
This is pretty basic, yeah.
Certain age that we're kind of looking at is, as you said, an Iowa resident, that makes sense, U.S. citizen, and kind of meets the guidelines and is also eligible for Medicaid or with the Iowa Department of Human Services, those financial guidelines. But those are all you're kind of basically looking at to be a part of this waiver network, correct?
Correct. And what's different or unique about this waiver is there's no wait list.
There's no wait list.
There's no wait list.
So all you really have to do is apply for this and start receiving the benefits.
Turn 65 and be Medicaid eligible, and then those additional services can help keep you at home, in healthier lives in the communities.
Are you kidding?
Yeah, it's a really great benefit.
And how long from when you first apply to when you'll be able to start, be able to take advantage of the benefits?
I'm sure it's going to be up to each individual situation and what's going on in that community. But if they go to the website at DHS and Google or look up, waiver specifically to the elderly, they can find out additional information, especially as would be specific to each person.
Do you know what specific service seems to be utilized the most for people in this situation?
A lot of people do the actual in-home health care, so a lot of the Meals on Wheels or the delivery meals. A lot of individuals across the state do utilize the transportation. That's a really big one, especially as we get closer to the cold weather and winter.
Yeah, absolutely.
So individuals don't have to walk or walk somewhere or take a bus. They can actually get a ride transportation that will take them to a doctor's office or possibly even to a grocery store.
Wow.
So that transportation benefit is a really big benefit for these individuals.
Is huge. I love this because it's not always easy to sometimes to have those conversations of how we need to make sure we're taking care of our loved ones
No
as
question
they
about that,
get
yeah.
older. But if there's something saying you can stay at home, but we're just going to give you that extra care, and United Healthcare taking care of us that way, that's wonderful.
Because our elderly Iowans are proud people, and they want to be able to do what they can to stay in their home, don't they?
Yes, and that is the goal. We want to keep people in their homes because we know that's where they're happier, they're more comfortable, and really they can help them live healthier lives staying at home and just really engage in their communities, and that is the goal of this waiver program.
Wonderful. Okay, so look further into the United Healthcare's home and community-based services with the Waiver Provider Network. 7 different waivers, but right now
There's 6 other ones beside that too they can look up, right?
There are, correct,
Okay.
yes.
amazing, but we really want to focus in on that elderly waiver, especially as we're heading into the holidays and seeing our loved ones probably again, and just let them know that this even exists and something that they should look into. Now, we know you have a website that we did have up on the screen, but you said the DHS website, and just search for those waivers is the best way to kind of get more information.
Absolutely. Our website will give people information about United Healthcare and the community plan for the state of Iowa, but
Okay.
if they want specific waiver information, the DHS website is the perfect place to go.
It must make you
Love
feel great working for United Healthcare, be able to provide information for services like this.
Yes, I do have the best job. I love working for United, and I love that we really do have a desire to help everyone in the state of Iowa live a healthier life.
Absolutely.
That
And what's
works.
been the feedback so far with people that realize this exists and they can really take care of the elderly like this?
You know, I think even for someone like me who didn't know or wasn't familiar with these services, it's just great to know that there are opportunities and there are provisions to help people who may not have the funding, but to stay in their homes. And, you know, I had grandparents that had a similar situation.
Yeah.
So it's just a really nice feeling, especially at the holidays, to feel comforted knowing you can provide for them and they're going to be taken care of at home.
Now, is this
Absolutely.
something that the elderly person themselves would have to apply for, or can a loved one apply for them?
They can work together.
They can
or,
work together.
Yes,
Okay,
they can. Mhm.
good.
And make it happen. Well, Katie, thank you so much for joining us today. This is
Absolutely.
wonderful news as we're continuing to look at our health, courtesy United Healthcare, but specifically this morning, looking at our elderly and making sure they're staying healthy, but they can also do that at home.
Wonderful.
Okay.
Thank you so much
Thank
for the
you.
information. And I think you opened up a lot of eyes here this morning.
Well, good.
That
Thank
works.
you.
Appreciate it.
All right.